This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar. Good afternoon, and thank you for joining us today for our HealthyU webinar series on managing stress and anxiety during the pandemic. My name is Christine Santini. I'm the Director of Marketing Communications at Mather Hospital. At any time during the presentation, please feel free to enter any questions you may have using the Q&A feature at the bottom of your screen. We will answer as many questions as we can within the time allotted once the presentation concludes. I'd like to introduce you to today's presenter, Marie O'Brien. Marie O'Brien is an adult health nurse practitioner and the coordinator for the Integrative Pain Management Program at Mather Hospital. Ms. O'Brien is an active member of the American Society for Pain Management Nursing and member of the Consortium for Nurse-Led Care. In her current position, Marie and her team seek to expand the use of holistic and integrative modalities to address not only the physical aspect of pain, but address the psychosocial, emotional, and spiritual aspects as well. Marie?
Thank you, Christine. And I want to thank everyone for joining us today. I'm very excited to be talking about this topic. This is so relevant in light of the pandemic and in light of the stress and anxiety that most Americans are feeling during this time. So I really appreciate HealthyU sponsoring this topic. Next slide, please. So for all of us, the COVID-19 pandemic has brought many, many changes. There are absolutely changes in how you live your life. Who would have thought our children would actually be attending school in our dining rooms? Who would have thought we would be concerned about going to our places of worship or going to the grocery store and having to wear a mask? So much uncertainty. And these uncertainties impact our daily routine. There are financial screen. Oh, thank you. Okay, sorry about that. Financial pressures, social isolation. We're all worried about getting sick. We're worried about how long the pandemic might last and what the future is going to bring. We're all dealing with information overload. In addition to that, rumors and misinformation can make our lives really feel like they're spinning out of control. And it makes it very unclear what we should be doing. So during this time, you may experience stress, anxiety, fear, sadness, loneliness, and those are all normal emotions. We're all people, we're all human beings, and we all experience these emotions in uncertain times. And then there are the mental health concerns, which include anxiety and depression. And for those of us who may be challenged with anxiety and depression, these uncertain times can worsen the symptoms of anxiety and depression. Next slide. Next slide, please. Thank you. So anxiety and stress really go hand in hand very often. Stress is a totally normal and expected response to situations and changes in our lives. Anxiety can manifest as a response to having stress. So the real trick is actually trying to identify when healthy levels of stress transition to disproportionate levels of anxiety when they are around a particular situation or event. Next slide. Now, In addition to the public health crisis that is COVID-19, national organizations such as the CDC, the American Medical Association, American Psychiatric Association, the NIH, just to name a few, recognize that the public health crisis of COVID is much greater than the risk of just the infection. Next slide. And the anxiety that people experience because of being in the state of a pandemic is actually one of the major concerns. So the stress and anxiety. So what exactly is anxiety? People can feel anxious about lots of things. The first day of school, a job interview, a first date. Anxiety is actually that little twitter that you get in your stomach, that pang of what if, that makes your heart race and your palms get a little sweaty. But there is a difference between healthy anxiety and a paralyzing fear about the future. And that's really where we should be concerned. So it's totally normal to have anxiety. It's actually good for us in small doses. But anything, too much of anything is never a good thing. And the same is true for anxiety. And if you are experiencing anxiety, please know that you are not alone. Anxiety disorders are among the most common mental health disorders in the United States, and they affect millions, over 40 million adults every single year. And adults are not the only ones who suffer from anxiety. Kids can experience anxiety as well. 25% of people between the ages of 13 and 18 live with anxiety. And these statistics are from the National Institute of Health. Next slide. The other challenge is that sometimes we may feel symptoms of anxiety and we might mistake them for symptoms of COVID. So you can see from this slide that comes to us from the NIH, symptoms of anxiety can include rapid heart rate, feeling of impending doom, feeling out of control, some cramping in your belly. And then symptoms of COVID, fever, cough, trouble breathing, fatigue. And then in the middle are symptoms that can occur in both. So I do urge you that if you have any concerns or you're unsure, please always reach out to your healthcare provider if you are unsure about what you're feeling. There's never a silly question and there's never a bad time to reach out to your healthcare provider. It is really important. If you're unsure, please talk to your provider. Next slide. Every person has their own healthiest self, and every healthy self is different from somebody else's healthy self. We all have different bodies, different minds, different living situations, and people that influence our lives. And each area can impact your overall health. And that means that we each have a unique set of health needs. So as we talk today, I want you to remember that some of these things that we discuss in terms of helping manage stress and manage our anxiety, some things are going to resonate for you and might work very well, and other things may not resonate for you, and that's perfectly fine because we are so unique, and the key is to find what works best for you. Next slide. One of the key factors in addressing stress is to understand our own stress. So I pose the question, how do you stress? Well, this is different for everyone, but by understanding what stress actually looks like for you, you can be better prepared and reach for your own stress management toolbox whenever it's needed. Next slide. We are all feeling stressed. So when we think about stress, the term stress, as we use it today, was actually coined in 1936. Hans Seeley defines stress as the non-specific response of the body to any demand for change. Stress is how the body and the brain respond to any demand. Any type of challenge, maybe a performance at work or school, a significant life change, or traumatic event, can be viewed as stressful. Stress can affect your life, and it is important to pay attention to how you deal with minor and major stressors so that you know when you really need to seek help. And again, please remember that stress affects everyone. Everyone will experience stress from time to time. There are different types of stress, all which carry physical and mental health risk. A stressor might be a one-time or a short-term occurrence, or it could happen repeatedly over time. Some people are more adept at coping with stress, and they have more effective coping mechanisms to deal with stressful events over some other people. But there's no right or wrong way to experience stress, and it impacts everyone in a different way. Next slide, thank you. So some examples might be, just like with anxiety, routine pressures from school, work, family, or daily responsibilities. Stress can be brought about by sudden negative changes, such as losing a job, divorce, or illness, or like we're experiencing now, a pandemic. Traumatic stress experienced during an event such as a major accident, war, assault, natural disaster, or a pandemic like we're all going through right now, where people are actually in danger. That stress might have may cause temporary emotional and physical symptoms. And most people will recover soon after the period of stress has gone away. And not all stress is bad. Just like with anxiety, not all stress is bad. In a dangerous situation, stress signals the body to prepare to face a threat or to flee to safety. That's our fight or flight response. So it's actually very helpful. In these situations, your pulse will get a little bit faster. You might breathe a little more quickly. Your muscles may tense up, and your brain uses more oxygen and increases in activity. So these physiologic things that happen to our body are quite helpful if we are in a life-threatening situation. So if you were in a burning building and you needed to escape from a fire, or you were in an accident and needed to get out of a car that was in an accident, this stress, when it stimulates your body to fight or flight and be more engaged, that's actually helpful for these dangerous situations. The problem is when stress hangs around for a longer period of time. Next slide. Your stress response is what happens as stress passes through the filter of your mind to occur in the body. So your body speaks to your mind, and your mind speaks to your body. Your mind recognizes that there is a stressful situation in front of you, such as a burning building or having to get up and give a speech at a HealthyU seminar. And then the mind communicates that information about the need to be on high alert, to cause your heart rate to increase, cause you to breathe a little more quickly, and get you ready to engage in an activity that requires you to be more acutely aware of what's happening and to be ready to either fight or flee or perform in a more meaningful way. So it's your mind communicating with your body. Next slide. However, when this type of response is very helpful in the short term, but long-term stress can harm your health. Coping with the impact of chronic stress can really be challenging because the source of long-term stress is more constant than acute stress. The body never really receives a clear signal to return to normal functioning. In times of acute stress, like we were just talking about, we have that increase in heart rate, increase in blood pressure, our increased mental acuity. The body is all ready, set, and go to engage in a challenging situation. And when when the body is ready to engage in that challenging situation, we engage in the situation, and then we should be able to return to normal. Everything should go back to its resting state. Your heart rate should come down, your breathing should go back to normal, your belly should start to get ready to digest food again. However, when we are in a constant state of stress, our body never really gets the message to turn everything back to its resting state. So with chronic stress, your whole body can recognize disruptions in the immune system, digestive system, cardiovascular, sleep, and reproductive system. Some people may experience mainly digestive symptoms, and other people might experience things like headaches, difficulty sleeping. They might be overwhelmed with sadness or anger or irritability. And over time, the continued strain on your body from stress may contribute to serious health problems, such as heart disease, high blood pressure, diabetes, and other illnesses like severe depression or anxiety, which can be very problematic. Chronic stress is known to be responsible for many chronic conditions. 75% of all Americans have moderate to severe stress, and this is before we were in a pandemic. At least 43% of all US adults suffer from some kind of adverse health effect due to stress. 75 to 90% of doctors' visits are related to stress-related ailments or concerns. And the lifetime prevalence of an emotional disorder is greater than 50%, and it's often due to chronic untreated stress reactions. So as you can see, this is very problematic for many people. And these statistics come from prior to us being in the middle of a global pandemic. Next. And when stress affects your body, you can see from the diagram here, it affects the entire body. Headache, dizziness, people might grind their teeth, cardiovascular issues. So stress really has a significant impact on our entire body. Next slide. But the good news is, I've been telling you many of the negative things, but I do want you to know there is good news. There are ways to manage your stress. And if you take practical steps to manage your stress, you have the ability to reduce the negative health risks that come along with having stress. So let's talk about some practical tips that might help you cope with the stress that not only you, but your family, your friends, your colleagues, everyone around you is dealing with. The key to this is actually the mind-body connection. Now, our health is truly supported through a strong and healthy body, a strong and healthy mind, and a strong and healthy spirit. So these things work together to create an optimal level of health. And when one of them is not strong, the other two need to jump in and can help. But the goal is to try and support each and every aspect of this three-legged stool to support our health. So the first thing we're going to talk about is breathing. Research has shown that mindful breathing decreases the physical effect of stress on your mind and your body. Next. Breathing, changes in your body affect your breath. Changes in your mind affect your breathing. Changing in your breathing affects your body. And changing in your breathing affects your mind. So we can just think about this for a minute. Breathing is one of those functions of the body that can happen all on its own, right? You can go to sleep and you're going to continue to breathe. You can be engaged in doing work or school and you will continue to breathe. So we breathe naturally without even having to think about it. However, we also control our breathing, and that's the key. So if we need more oxygen, right? Your body is engaged in something stressful and we need more oxygen, your body will automatically put that demand on that connection between your brain and your lungs, and we breathe a little more rapidly to allow us to have more oxygen. But we also, our brain can tell our breath to slow down. So we have control over how fast we breathe, how deep we breathe, with what intent we are breathing. So this connection can be very, very powerful. And as a side note for any healthcare clinicians that are listening, this is very important that we convey this to our patients, because we have a nerve that runs through or is connected to the diaphragm, our vagus nerve. That vagus nerve, which is connected to the parasympathetic nervous system, the opposite of that fight or flight response that we've been talking about, that vagus nerve has the ability to be stimulated when we take a deep breath. So through taking a deep breath, dropping our diaphragm, that deep breath can stimulate that parasympathetic or our rest and digest system, which is extremely powerful. Next slide. So I'd like us to try this just for a minute. And again, like I said, research has supported that this mindful breathing can have a very beneficial effect on our breathing. So I'd like us to all be clear on how to actually take a mindful and relaxing breath. So when we take a mindful and relaxing breath, we can place a hand on our belly. So I'm going to ask you if you wouldn't mind putting your hand on your belly. And as you put your hand on your belly, I'd like you to slowly and carefully or consciously take a deep breath in through your nose. And as you take that deep breath in through your nose, feel the air filling your lungs, expanding your diaphragm, filling in your belly. And as you breathe in, your belly will expand. And then the opposite way. So I'd like you to exhale slowly and consciously. And focus on what that breathing can do for you. So in through your nose, down into your lungs, down into your diaphragm and your belly. Hold for about a second, and then exhale. Feeling the lungs come out through, feeling the air coming out from your belly, up through your lungs, back out through your mouth. Slowly, mindfully, with intention, breathing. And as you breathe, it can be very helpful to focus on an intention. So just saying to yourself as you are breathing, relax, calm, can be extremely helpful and beneficial. So I challenge you over the next couple of days remember this. Remember the happy smiley face that goes along with breathing. And when you're feeling a little tense, just take a moment or two to take some slow, deep breaths and focus on how the breathing can allow your heart rate to slow and allow you to feel more comfortable and content. And the more that you do this, the easier that it will be and the more powerful it will be. Next slide. Be observant. So this is important to recognize the signs of your body's response to stress, such as difficulty sleeping. Maybe you might have an increase in alcohol or substance use, which is a concern right now for many people. If you're feeling easily angered or depressed, if your energy is not where it normally is, just being observant of what stress is doing to your body can be one of the keys to implementing something that can counteract the negative effects of stress. Next slide. So this is where techniques like a body scan meditation can be helpful. So in a body scan meditation, we are being observant of what's happening in our body, recognizing areas in our body that might be a little stressed, where we might be holding some tension, and also noticing where we're doing a good job. Because some people hold tension in one place and other people will hold tension in another. So if we can identify where we actually hold our tension, it can be very helpful in implementing something to reduce that tension. So I'm going to ask you to join me again, and we're going to try this body scan meditation. Now, if you are driving a car or operating a forklift or doing any other activity that requires your full attention, this is not the right time to practice this exercise. Okay, so make sure that you are in a safe place. And I'm going to invite you to join me in this body scan meditation. So if you could sit comfortably in your chair, plant your feet on the ground, lift up your torso straight, and feel the support that your chair is providing to you. Now, this is an activity of observation. There is no right, no wrong, no good, no bad. I'm going to ask you to take notice and bring awareness to how the environment may affect your body. So I'm going to ask you again to take a deep breath, just like we did before. Take a deep, slow breath in through your nose, down through your diaphragm, all the way to your belly, and exhale very slowly. And I'll ask you to do that again. And if it's comfortable for you, you can close your eyes. If not, that's okay too. And we're going to start with just noticing our head. We're going to start with the top of our head. And I'm going to ask you to just notice what you might be feeling up there. Are you feeling cloudy and full, dizzy, or is your mind open, spacious, relaxed? Just notice, nothing to do, nothing to act on, just notice. And as we leave the head, we're going to move down to the face and just notice, what is your face feeling like? Is it relaxed? Is it clenched up? How's your jaw? Is your jaw tight? How about your teeth? Or do you have any tightness in your jaw or your teeth clamping down? And your eyes, are they soft and relaxed? Or are they kind of scrunched up and tight? It's okay. Doesn't matter. Whatever it is, it is. We are just noticing. Move on down to your shoulders. Where are those shoulders? Are they up close to your ears? Or are they down, relaxed? Any tension? How about your arms and your hands? Are they feeling full of energy or tightness? Or are they relaxed and calm? Just notice. Nothing is right or wrong. Let's move our awareness to the chest and see how we're feeling. What's going on here in the chest? Is your heart fast? Is it slow? Are we feeling tension? Are we breathing easily, slowly? Does our chest feel full of joy? That would be great. Or is it heavy? Whatever it is, just notice. Move on down to your belly. Is your belly feeling spacious and open? Maybe we have some rumbly in our tumbly. Are we feeling a little nauseous? Doesn't matter, whatever it is. Move on down to your legs, your lower legs. Moving on down to your feet. And now I'm going to ask you to notice your feet a little bit more and feel your feet on the ground and how the ground and the earth is coming up through you, feeling the energy coming up from the earth into your feet, into your legs. Just notice. And whenever you're ready, I'm going to invite you to open your eyes. And again, take another slow, deep breath and just settle in with yourself and think about what that felt like. And if you noticed any areas of tension and areas that were full of joy and full of happiness. Because in doing an exercise like this, you're able to be observant of what's happening in your own body and just checking in to see where stress might be burdensome to you or where maybe you're handling it pretty good. Okay, next slide. Now, another challenge that many of us have is information overload. So every time we turn on the TV, listen to the radio, turn on the computer, there's a lot of negative stimulus coming from all different directions. And your body and your brain has a very difficult time for everyone. And this happens with everyone. The brain and the body has a very difficult time recognizing an immediate physical threat, like being in the middle of the woods and a lion ready to pounce on you, or hearing something scary and crazy about what's happening out in the world that maybe is not causing an immediate physical threat to your body. So when we are fully surrounded by all kinds of stimulus that is all negative, it makes it very challenging for our bodies to deal with stress and for our mind to combat the negative effects of stress. So I'm just offering a suggestion that perhaps make an attempt to either tune in or log in to a reputable source of information, not opinion, and limit your time to what is tolerable for you. And you can use that body scan meditation as something to help you with this. So before you watch the news or tune into your favorite news station or where you get your news from, computer, newspaper, whatever, do the body scan, see how you're feeling, engage in a short period of time, maybe a half hour or an hour, whatever seems logical for you, and set a timer. When that timer goes off, do the body scan again and take notice of what your body is feeling after you have taken in information. And that will be a cue to you to know it was either too much, or maybe you're not feeling any different than when you started. And if you feel like tuning in longer, that's great. But this is just a suggestion to see what works for you. And building your own toolbox really comes from listening to your own body. Next slide. Guided imagery. Now, guided imagery is actually a very useful tool to help us allow our bodies and our minds to communicate. Next slide. So I'm going to ask you again, if you are not driving a car, operating a forklift, or doing anything that requires your full attention, I'm going to ask you to close your eyes if that feels comfortable to you. Again, seated in your chair, feeling that full support of your chair. Feet firmly planted on the ground. Take a slow, deep breath in and breathe out. And as you are closing your eyes, I'm going to ask you to imagine. Imagine that you are in your house, and you may be there already, or you might be someplace else, but wherever you are, seated in your chair, as you close your eyes, you're going to bring a picture of your kitchen in your mind. You're in your kitchen, looking around your own kitchen. Feels very homey. And if you could, imagine that you are walking towards your refrigerator. And as you walk towards your refrigerator, you may hear the creak of the floor. You may feel a nice breeze coming in through the open window. The window is open, you might smell the fresh air. As you walk towards your refrigerator, you're going to reach out, open the refrigerator door, take your hand, put it inside the refrigerator, and you're going to pick up a lemon. Now, you may not usually have lemons in your refrigerator, but for today, you do. So you pick that lemon up, take it out of the refrigerator, feel the coolness coming out of the refrigerator, close the door, bring that lemon over to the area where you normally cut up your fruits and your vegetables, take out your favorite cutting board, place your favorite cutting board on the counter, put the lemon on top, take out your favorite knife, and you are going to make a slice through that lemon. And you notice some lemon juice squirts out all over the cutting board. Turn the lemon around, take another slice, put down your knife, pick up that lemon wedge, bring it up to your nose, take a nice whiff. Ooh, it smells so lemony. And now you're going to take that lemon and put it right in your mouth. And you're going to feel the lemon juice trickling down the back of your throat. Oh, it feels so good and refreshing and tart. And now I'm going to ask you to open your eyes. Now, I don't know, it's kind of hard for me because I don't see all of you, but typically when I do this exercise with my patients, I typically, as I ask them to take a bite of the lemon, their faces get all crinkly and their mouth gets all puckery and they're swallowing extra saliva because just the image and the thought of a lemon can cause a physiologic change. And that's very important to know. So I'm going to ask between now and when the webinar is over, maybe you might throw into the chat what you saw, what you heard. If you were able to taste the lemon, I'd be really interested in knowing what everyone thought. But I want you to remember this as an exercise that helped you understand that there is a true connection between your mind and your body, because your body was getting ready to actually eat the lemon. Okay, next slide. So imagery is what we just did with the lemon, and that's a natural thought process using one or more of the five senses. It's right brain thinking, and it's the bridge between the conscious and the subconscious. It's an active response, and if we can imagine, then we can create. And if you can worry, you can imagine. So when we have worry about things that are going on in the world, that's our imagination. We're imagining all the things that could possibly happen, as opposed to maybe what is actually happening. So this process can be helpful or it can be harmful. So if we can utilize it in a helpful way, it can be one of those tools in our toolbox. Okay, so guided imagery is a process that facilitates working with the power of the imagination to positively affect mental attitude, potentiate positive outcomes, and the active innate healing within the body. Now, you can find guided imagery programs on the internet. YouTube has a lot of great guided imagery or self-hypnosis programs. So if you just type in on YouTube, if you're adept at the computer, guided imagery for stress or guided imagery for relaxation. And Mather is connected with Northwell Health. The Northwell Center for Health and Wellness actually has free guided imagery downloadable programs on their website. So that's a really great place to look. Next slide. Mindfulness. I love this little picture, right? The person mindful, their mind is full of stuff. Car, the house, going to work, paying the bills, all kinds of stuff is just running around their mind. So their mind is full versus the dog who is mindful, where they're just enjoying the present. So you can see what the dog is imagining or what the dog is seeing in his mind is what's happening. They're walking through the park with the trees and the sunshine. That is truly mindful. Next. So I question, where are you? Are you living in the past? Are you thinking about the future? Or are you in the present? Your body is always in the present. Always. Your body cannot be in the past or the future. It is always in the here and now. So we need to keep our mind in the here and now. And mindfulness activities or mindfulness exercises are very useful in helping us keep our mind in the present. Next. So gratitude. Gratitude is a great mindfulness practice. It allows us to focus on things that we are grateful for and can allow us to focus on the present. So I invite you to express or contemplate a feeling of gratitude for something each and every day. Write it down, think about it, focus on it, thinking about something that you are truly grateful. Pick one thing each and every day to think about what you are truly grateful for, because amidst all of the chaos, there is always something that we can be grateful for. Next. So heart-focused meditation, and unfortunately, I think we're probably a little short on time. So I'm not going to be able to do this meditation with you, but I'll invite you when this is over. This is very simple to do. And through thinking about your heart and feeling something grateful in your heart and focusing on it for a minute or two, you can have a greater feeling of peace and calm. It's called heart-focused meditation. Next. Okay, next. Another valuable tool in managing your stress is getting enough restorative sleep. Sleep is extremely important, and it's something that I think we take for granted so often. Without adequate restorative sleep, your brain does not have the ability to put all of the daily files into place. I like to think about, when you come in from the mailbox with the pile of mail, and if you're like me, maybe you're more organized, but if you're like me, the mail goes into a basket, and I don't get to sort the mail out until the weekend when I have more time. So all that mail builds up, and there's envelopes, and there's junk mail, and there's postcards and stuff that I want to throw away. But it all builds up over the course of the week, and then on the weekend, I sort through and throw away the garbage and keep what's good. So sleep is like taking that basket of mail and sorting through everything and keeping what's good and dumping out the junk. Sleep allows your brain to sort through and organize everything you've learned, experienced, whatever you've gone through, you want to remember. Sleep allows your brain to reorganize information and allow you to have things in a more consolidated, easily accessible format. So good sleep hygiene, making sure that you have a designated sleep schedule, go to bed at the same time, wake up at the same time. Whatever is good for you to help you get restorative sleep is important. And restorative sleep would be probably another whole HealthyU seminar. So I'll ask you to reach out to your healthcare provider if you're not getting adequate restorative sleep, but it is an important component to your sleep, to your stress toolbox. Next slide. Exercise. 30 minutes of exercise per day walking can boost your mood and improve your health. Getting out in the sunshine, getting your vitamin D, building up those positive endorphins are all excellent to help manage stress. Next. Eating a healthful diet. Food is nourishing. The wrong foods can increase inflammation, and the right foods, like your green leafy vegetables, fresh fruits, lean protein, can all help decrease inflammation. And the right food can enhance your immune system, which is so valuable when we're all trying to stay healthy. Next. Journaling. The practice of journaling has so many positive health benefits. It decreases stress, it declutters our thoughts, it allows us to take our mindful. So if you remember the picture with the little man and he had all this stuff in his thoughts, journaling can allow you to take all that stuff and put it onto paper. And it allows your mind to get rid of the things that you should not be focused on, because now you don't have to remember, you don't need to think about them anymore. It allows you to get your thoughts out. So there is a very big health benefit to journaling. So I invite you all to investigate that a little bit more and consider journaling. Next. Setting goals and priorities. So this goes along with a practice of journaling. Making a decision about what must get done now and what can wait. Learning to say no to a new task if you feel like you're taking on too much. Being mindful of what you have to accomplish at the end of the day and not what you have been unable to do. So many times we give ourselves unrealistic expectations about what we should be doing, and we forget to be grateful for all of the things that we have gotten done. And then making a list. So making a list of what you need to do, what you have accomplished, what you need to accomplish, putting it all on paper, either through journaling or a notebook or your phone. It allows your brain to let go of clutter, and it allows you to focus more clearly on what you need to do. Next slide. Brainstorming pleasant activities. So again, I think I'm probably getting a little short on time, But I invite you, when we're done, take out a piece of paper, set a timer for 2 minutes, 3 minutes, come up with a list of activities that you find enjoyable. It doesn't matter if it's a crazy idea. It doesn't matter if it is something that you don't think you'd be able to do. Whatever it is, write it down and brainstorm on how you might be able to accomplish it now. Most things can be accomplished with some form of modification. So I invite you to brainstorm your list of fun and pleasant activities. And then once you get all those activities down on paper through brainstorming, go through and pick out several of them that can be modified to the way life is right now in the pandemic. And keep that list for when you're feeling overwhelmed and you're looking for something joyful to do. Next slide. And the same is true for a relaxing activity. So there are fun, pleasant, let's go do stuff activities, and then there are activities that are relaxing, like meditation, progressive muscle relaxation, breathing exercises. Please schedule regular time for these and other healthy and relaxing activities, because if you don't schedule them, they're typically not going to happen. So you need to make time for you and make time for you to find joy in some part of your day. Next slide. Stay connected to your friends and family. Anyone who brings you joy, the people in your life who bring you joy, stay connected with them. Next slide. Self-care is not selfish care. Caring for yourself is not selfish. Remember, if you've been on an airplane, probably been a while for many of us, but what do they say? Put on your own oxygen mask first before you help the person next to you. So I urge you to take care of yourself. Take time to practice something, hopefully more than one something, but at least something that provides self-care for you, because it is not selfish, but it does take practice, and it's not easy for many of us. Next slide. This is not an all-inclusive list. Finding what resonates with you is the key to sustaining lifelong wellness practices. You need to find what works for you. Next slide. And if you are really struggling, I urge you to please talk to your healthcare provider or another health professional. Don't wait for the healthcare provider to ask you about your stress. Start the conversation with them and get proper healthcare for any new or existing health problems. Many of us have avoided going for our screenings. We've avoided going to regular doctor's appointments because of the pandemic. But please, please take care of yourself, both physically and emotionally, and reach out to your healthcare provider. Next slide. So what happens when this is all over? What happens when the pandemic is in our past and done? Stress is always with us. You can expect the current strong feelings of stress to fade when the pandemic is over, but stress is not going to disappear from our lives once COVID is over. Continued self-care practices take care of your mental health, and they increase your ability to cope with life's ongoing challenges. But it does take practice and commitment, and it's a lifelong journey. Next. We are truly all in this together. We are much more alike than we are different, and we are all moving through this great unknown together. Times of hardship will ultimately create greater times of joy. We can't feel joy if we don't know what hardship was like. So we have to recognize that this will be in the past at some point and find joy in everything that we do each day. Next. Thank you. Any questions?
Thank you, Marie, for your extremely informative and relaxing presentation. If anyone has any questions, you may enter them in the Q&A feature on the bottom of your screen.
Did I get any responses to what people saw or heard or tasted if they participated in the lemon exercise?
Nobody's entered anything. You put everyone to sleep, Marie. If you have any questions at the end of this presentation, please email us at matherhospital@northwell.edu so we can answer them for you. Oh, we do have some questions. We can get to a couple of these before our time is up. Can you suggest any techniques or answers that we might give to people who invite us in situations that make us uncomfortable during the pandemic?
So I think the key to that is recognizing that you do feel uncomfortable and being honest, right? We need to be true to ourselves. And if we feel uncomfortable, that's only going to cause a greater feeling of stress inside us. It's perfectly okay to tell someone else that makes me feel uncomfortable, and maybe we can brainstorm together to find a more appropriate situation to spend time. If maybe it's a friend or a family member, do something outside, or go somewhere where you can wear a mask. Or making sure that you feel comfortable with the situation is very important.
How long does extreme stress last if I am practicing all the items you described?
That's a good question, and unfortunately, I don't have a good answer. It takes practice to be in check with our own bodies. So doing something like the body scan, where we're able to recognize where we're feeling stress, and then maybe doing a stress reduction technique like one that I spoke about. Or if you look at reputable websites like the NIH or the CDC. There's a lot of good information there about stress reduction, as well as the Northwell Center for Health and Wellness. They have a lot of good stress reduction programs. But if you find yourself engaging in a stress reduction activity and you find that it's helpful, maybe it hasn't helped all the way, but it helped a little bit, you're on the right track. So consistency is so important. We can't expect to do one breathing exercise or go to a yoga class or do meditation once or twice and have all of our stress go away. It's like our patients, if I have a patient who has high blood pressure or diabetes, it's lifelong management. There's not one specific intervention that's going to eradicate all stress. It takes time and it takes practice.
We have time for one more question. How do I avoid friends who are stressing me out?
That's a very good question. We cannot always avoid our friends. We can educate our friends. Maybe invite them to do a stress reduction technique with you. Maybe you could do an online yoga class. Get together and you can be at your house, they can be at their house, you can do yoga together. Maybe share some stress reduction techniques with them. Many people just don't know how, maybe they don't recognize their own stress. So maybe they don't realize that they are putting their stress onto you. but you are the only one who can take on that stress. So recognize that you don't have to take on everyone else's stress. They need to leave that with them. And if you practice on your own self-care, you will be more resilient to that.
Thank you, Marie. Unfortunately, we're out of time. I do see more questions. If you wouldn't mind emailing those to us at matherhospital@northwell.edu, we will reach out to Marie O'Brien and get back to you with any answers that you're looking for. Thank you again for joining us today, and thank you, Marie. Once you exit the webinar, you'll see a link to complete a survey. If you could please complete the brief survey, your feedback is extremely important to us. Thank you.